Meet Helen. Helen is a mother of 3 and a grandmother of 4. Since her family is so spread out all over the country, she relies on her computer to keep in touch. Her doctor recently prescribed her a new medication for her worsening rheumatoid arthritis, given her ability to type has become increasingly difficult.
It's okay because my doctor's the best. He published a book and went to one of those fancy Ivy League schools. Plus, he's very handsome.
But before Helen picked up her new drug prescription,
You've got mail.
her daughter sent her a link to a video series on the internet called ShowMeTheEvidence.com. Helen watched all the videos and for the first time in her life, thought about using evidence to make sure she was getting the right treatment.
At first, I thought I could never understand evidence. I mean, I don't have a science degree and I've never been very good at math. But after watching the videos about evidence, I realized I had found and used more evidence about my new refrigerator than I did about this new, powerful, and very expensive medication. I had no data proving whether or not this new drug really worked or had any side effects. My doctor told me,
This drug is marvelous. It works great and it's rare for any patients to have any severe side effects.
Helen launched her quest for evidence by first watching the PICO tutorial, which enabled her to frame her medical question and make sure she was going to get relevant evidence.
my PICO medical question is, what is the evidence that my new RA medication will decrease my pain and increase my finger and hand mobility without increasing the risk of cancer compared to my old RA medication in older, healthy females?
Great job!
Now that I have my PICO medical question, I think I'm ready to look at the evidence. Can you help me?
Absolutely. Evidence is sometimes in the eye of the beholder. Experts and non-experts don't always agree on what is good or bad evidence, but there are some universal recommendations that most everyone agrees on when trying to weigh the relevance and reliability of the evidence you will use to make a healthcare decision.
Let's do this.
Evidence is the data that comes from scientific studies. Most of this data is represented by numbers, and with basic math skills, anyone can use these numbers to figure out how many patients like yourself were given any treatment, and the percentage of those patients who had a bad or good outcome.
If I can do it, you can do it. Believe me.
Here are the 6 most important concepts to understand while reviewing and judging the evidence. First, it's important that you look at studies that include patients that are similar to you. The more the patients in the studies are like yourself, the more relevant the results of the studies will be to your own unique medical condition. For example, you want studies with women, not men, and otherwise healthy women above the age of...
Careful how you finish that sentence, narrator.
Moving on to the next evidence concept, number of patients. Studies that have more patients are generally more reliable. 100 is better than 10. 1,000 is better than 100. However, in some cases, small studies have value, especially if there are no large studies published. Think of it this way. Do you ever look at consumer reports or Amazon reviews before buying a new appliance or gadget? Would you be more likely to buy a refrigerator that had 90% approval based on 10,000 customers, or another refrigerator that had a 90% approval but only based on 100 customers?
You're right. I chose my new refrigerator based on surveys that had the largest number of reviews.
Comparisons. You want studies that compare all the treatments you are interested in. Judging by your PICO medical question, you probably want studies that compare your new medication to your old medication, or possibly to other drugs of the same kind.
Correct yet again, Mr. Narrator. I want to see the evidence that says my new medication helped more patients than my old medication.
Follow-up time. Longer studies are better than shorter studies. However, the ideal follow-up time does depend on the disease, treatment, and the specific outcomes of interest. For example, if you want to know if your new RA drug truly relieves pain and improves mobility for at least a year, then you don't need studies that followed their patients for more than 1 year. If you want to know if a rheumatoid arthritis drug causes cancer, then you want studies that follow patients for many years, at least 5 to 10 years.
I'd like to know both. I want to know if this new drug will alleviate my finger and hand pain and mobility problem for at least 3 years. And I sure don't want to have to worry about getting cancer if I stay on this drug for many years.
It may also be helpful to think about a service like E-Trade, where you can cherry-pick mutual funds that have good returns over 15 years, as opposed to other mutual funds that have good returns over only 3 years.
How wonderful. Could you also help me pick a good mutual fund too?
Let's just stick to medical evidence for now. Concept number 5, outcomes. Make sure the studies have outcomes of interest. In your case, the outcomes you are interested in are pain relief, increased mobility, and cancer. You can also consider outcomes such as improved X-rays or lab results. These kinds of outcomes are known as surrogates. Some studies only report surrogate outcomes. Clinical outcomes, on the other hand, are what patients actually experience, such as decreased pain or increased range of motion. Clinical outcomes are more reliable than surrogate outcomes when trying to determine the true efficacy or safety of a therapy. Absolute relative difference. Here is the most misunderstood concept in the world of medical evidence. There are 2 mathematical ways to measure the size of the difference between 2 treatments. The first way is known as the absolute difference. It simply tells you how much better or worse one treatment is compared to another treatment. For example, 8% of patients who took drug A got cancer compared to 4% of the patients who took drug B. The absolute difference is 8 minus 4, or 4%. Simple subtraction. The second way is called the relative difference. The relative difference measures the relative difference between 2 treatments. This number is calculated with a complex equation that requires both subtraction and division. The relative difference for the above, 8 minus 4, is then divided by 8 and multiplied by 100, which gives you 50%. That's how they calculate the relative difference. No, you don't need to memorize that equation, but it's critical that you always review both the absolute and the relative difference together, given those 2 numbers are very different. 4% versus 50%? Which number would you believe? Which is more accurate?
Okay, that all makes sense. So how do I get my hands on some good evidence?
First, ask your doctor for the evidence. If he is too busy or can't get the evidence, then hire a medical librarian or call companies, medical societies that provide evidence. One good example is Dr. Evidence, who has been doing evidence projects for patients for over 10 years.
I'm gonna call my doctor right now and ask for evidence. Hi doctor, it's Helen. Show me the evidence that this new drug is better than the old drug. Hello? Hello? Hi, is this Dr. Evidence?